Om Shri Sai Ram. I offer my love and gratitude to Bhagavan Sri Sathya Sai Baba. Brothers and sisters, welcome to this webinar. The UKCC, the National Healthcare Committee, and the media team join me to wish you a very happy, prosperous, and blessed New Year. Tonight, our Health Series webinar looks at some common cardiac conditions. Heart disease covers a range of conditions that affect the heart and cause cardiovascular problems. Our speaker tonight is Dr. Suneil Aggarwal. Dr. Aggarwal completed his medical training at the University College London Medical School in 2002, his general medical training in Oxford, and completed his MRCP in 2005. Dr. Aggarwal has been a consultant cardiologist in Liverpool since 2015 and currently leads in performing several cardiac intervention procedures. He's actively involved in research and training. During his training, Dr. Aggarwal had also spent 3 years at the Super Speciality Hospital in Puttaparthi in the Department of Cardiology, where he still goes for voluntary work and teaching. Dr. Aggarwal has taken part in many international medical camps and local health awareness days in the SAI organization and is currently an active member of the Sri Sathya Sai Center of Warrington. Jai Sai Ram.
Sai Ram, and good evening to everyone. Many thanks for that kind introduction. And thanks for this invitation to talk at this month's healthcare webinar. So, as you know, my topic is going to be on common cardiac conditions and prevention of heart disease. So I will get straight into it. So, what are we going to talk about today? Well, we're going to talk about what the heart does and then what the common conditions are that can happen to the heart, and then some of the strategies to prevent heart disease. So it's important to note that the heart is essentially a muscle, and its job is to pump blood around the body. And like any muscle, the more it is used, the stronger it gets, which is basically exercise. And if we think of the heart really as a plumbing system with an electric supply, then it becomes easier to understand how any part of the system can become defective and cause different types of heart disease. So how common is heart disease? Well, I mean, just as a ballpark figure, in 2010, although that's a few years ago now, there were 65,000 deaths in England from heart disease, and at that time it was the most common cause of death. It has slowly reduced over the last decade or so, but it's still the second most common cause of death after cancer. There are about 100,000 people who have heart attacks a year, and about 2/3 of these are men. And there's about 1.2 million people living in the UK who've previously had a heart attack and obviously survived it. And one important aspect that we need to consider is that it is 46% more common to have heart disease in South Asians than Caucasians. So most of us, being of South Asian heritage, obviously are more prone to heart disease, and therefore it's even more important that we concentrate on prevention. So what are the most common cardiac conditions? Well, the thing that we mostly talk about is coronary heart disease. And this is caused by a buildup of plaque, mostly cholesterol, in the small blood vessels, the arteries which supply the heart. So you'll see in my picture there is the normal artery, which is very smooth, and then there is what we call atherosclerosis, which is basically the buildup of this plaque, as we call it, in the heart over time. Now, initially, this might build up when you're even quite young, and we know that if you look at the big arteries in the body, even from the age of 20, there is evidence of this in almost everyone. But clearly, the more you get build up of this material in the artery, the narrower it gets. And if you then end up having a heart attack, That is basically where, on top of this narrowing, you then get a blood clot. So why do you get this? Well, it's caused by various factors, many of which I'm sure you're aware of. And the real issue is that, we can control a lot of these factors ourselves and prevent heart disease to a great extent. So we think of the major risk factors, of course, smoking. I think we all know that that's a major cause of heart disease and heart attacks. High cholesterol, some of which, it has to be said, is genetic, not just dietary. Obesity, and it is important to note that although BMI is the most commonly used way of used method of assessing your weight compared to your height, actually, especially in South Asians, BMI now of over 23 is considered by the WHO as being overweight rather than greater than 25. The other thing is that actually the waist, absolute waist size is very important. So the fat around the stomach is of more concern than fat deposited elsewhere, because it's a good reflection of the fat that's being deposited inside the body. Diabetes is a very important risk factor. In fact, if you have diabetes, your risk of heart disease is the same as someone who's previously had a heart attack. So controlling blood sugar is key. High blood pressure is another important thing, which most people are aware of, can cause heart disease and strokes. And then one thing that you can't really do anything about is a family history. So if you've had heart disease, or if you have family members who've had heart disease at a younger age, we usually define that as less than 60, and that means you're more prone to heart disease yourself. And so although you can't do anything about that, it's something to be very wary of if you have members in the family, close relatives who've had heart disease at a young age. And then physical inactivity. So even people who are of normal weight, we know that if they're not physically active, they are more prone to heart conditions. What are the common symptoms? So the most common symptom is stable angina, which is basically when you get a discomfort or pain in the chest, often described as a pressure, but in some people it might be described as shortness of breath as well, and that is on exertion. Because like I said, the heart is a muscle, it needs blood to supply it. If you get narrowings, of course, in the blood vessels, then blood is going to struggle to supply the heart. And then if you do some sort of exercise or exertion, then your heart needs more blood. And if you have those narrowings, then you can't get that extra blood. And that's what causes the discomfort. Then there's the heart attack, which is a more concerning symptom, where you essentially will have chest pain at rest. Often things we talk about, like the pain goes up into the left arm or jaw, sometimes even the right arm. It's often associated with shortness of breath and sweating, also nausea or vomiting. And this is a much more urgent condition in that it's one of those things where you need to be calling 999 and getting urgent help, as that needs to be treated straight away. What are the treatments? Well, for stable angina, really, medications are often adequate. And in fact, there is very little evidence that any treatment above medications actually increases people's life expectancy if they have the stable symptoms, so the symptoms when they exert themselves, but not at rest. However, if despite medication people are still getting chest discomfort, then usually they'll be sent for something called an angiogram, where a tube is usually through the wrist, but sometimes still through the groin, pushed into the heart, and pictures are taken of the arteries by injecting some X-ray dye. And at the same time or in the same manner, if a narrowing or two narrowings are found, often you can open this up with a balloon, which is known as angioplasty, and you can put something called a stent in. So this diagram shows that here, where a stent is going into that blood vessel, it's expanding on a balloon, and then it's just left in place there. However, if you have multiple narrowings or narrowings in certain locations, and in fact, especially if you're diabetic, often a better long-term result will be achieved by open heart surgery or bypass surgery. If you have a heart attack, then actually things are very different. So if it's a major heart attack, then typically you will go for this procedure with the angiogram and potentially stent insertion as soon as it's diagnosed. So, we have people coming to our hospital who within, an hour or two of their chest pain starting, being rushed in for this procedure. The next common condition of the heart that we can discuss is heart rhythm disorders. So, like I mentioned, there's plumbing of the heart, which we've looked at, but then there's also the electrical supply of the heart. And this is an important and fairly common condition. So the most common among these is atrial fibrillation, which is basically where the upper chambers of the heart beat irregularly. And it's most commonly felt as, an irregular heartbeat or palpitations. And the main treatment for this is to control the heart rate so it doesn't go too fast. And also this particular condition, because the blood doesn't flow properly through the heart, and it may sort of stagnate and can form blood clots. And those clots can go up to the brain and cause a stroke. So a really important aspect of this condition is blood thinning. If we look at other common conditions, one thing is extra heartbeats or ectopic beats. These are very common, and actually in most people they're normal. And if you do a monitor on everyone, everyone will have some of these in a day. So it's only really an issue if you get a very large number. And the other thing is the heart can become very slow because the electrical conduction of the heart degenerates, usually as people get older, but it can be something that happens at a young age, or people can even be born with this. And it may be termed as heart block, depending on the severity of it. And there are different treatments for these different rhythm conditions. So one thing is something called an ablation, where a tube is passed up, or a few tubes from the groin to the heart, and they actually burn away abnormal electrical circuits. The next thing is, if your heart's very slow, you might need a pacemaker, which is shown there, which is basically a little battery, which is put under the skin, usually under the left shoulder, and then small wires go into the heart, and they help it beat at a normal pace if it slows down. And finally, a slightly larger device, but similar to the pacemaker, is a defibrillator. So in people who have a condition where the heart starts to beat very fast and they're at risk of cardiac arrest, they may have one of these devices put in. And that needs very careful monitoring. Another common condition is heart valve disease. So there are 4 valves in the heart, 2 on the right and 2 on the left. And like valves in a car or plumbing system, they are there to ensure that blood only flows in one direction. Now they can become narrow, either at birth or usually with age, or they can become leaky. And very often you will hear about people having a heart murmur. And certainly in adults, the most common cause of this heart murmur, which is basically a sound the heart makes when the blood isn't flowing normally, is a valve disease. A little bit of valve disease is very common, but it's only if the leak or the narrowing becomes severe that you might need some sort of treatment. For most people, this is open heart surgery, but there are some methods by which you can repair or even replace some heart valves through keyhole surgery, either through a small cut in the chest or even through the groin now. So thanks to technology evolving very rapidly, treatments are getting better and better with time, and importantly for patients, less invasive. Another heart condition, which is certainly less common than these, is congenital heart disease. So around 1 in 100 to 2 in 100 people are born with an abnormality of their heart. Very often this is actually not of any consequence, but it certainly can be for a lot of people born with heart conditions. You might often hear the term hole in the heart, which is a very generic term to describe, some of the conditions in the heart where there may be a hole between two sides of the heart, or even other issues with the plumbing of the heart. You can be born with narrowings in the heart or in the general blood supply system for the body, and also valve problems can be there from birth. And sometimes there's a complete abnormality of the plumbing, whereby different chambers of the heart are attached to wrong chambers or wrong tubes coming out of the heart. And certainly previously, most of the children born with these kind of conditions would die, but nowadays, for the vast majority of these babies born, they can have surgery in early childhood to fix this, and more are surviving to adulthood. And very occasionally you can survive to adulthood even with some of these conditions, and certainly in places like India this is a lot more common than it is here. A term people might hear is heart failure, which certainly sounds very worrying, and it has to be said, actually it is concerning, because we know that patients diagnosed with this condition, heart failure, have a worse prognosis, a worse outcome in general than the average person diagnosed with a cancer. And from a medical point of view, heart failure is defined as a condition where the heart is unable to pump blood adequately to supply the needs of the body. Most commonly this develops after damage from a heart attack, but actually any serious heart condition, whether it's congenital heart disease or valve disease or even rhythm problems, can end up with heart failure, where the heart can't pump enough blood around the body. And because we're getting better at treating lots of heart conditions, less people are dying of heart disease, but they may often have suffered damage to the heart. So more and more people are living with heart failure. The most common symptom for this is shortness of breath, and also swelling particularly of the feet. And this is essentially because if you're not pumping blood around the body adequately, fluid from the blood can leak out into the tissues, both in the lungs and in the skin. And so, of course, if you're standing up naturally, the place it'll go is the feet. But, the lungs are another major place where this fluid can build up, and that causes the breathing issues. So this needs some very careful treatment, most of which is by medications to help symptoms, but also a lot of medications have been shown in this condition to help people live longer. So although they may not make people feel better, but they're very important for long-term survival. It has to be said that treatments for this condition are being evolved all the time, and every few years actually new, really life-changing medications are being developed for this to improve people's symptoms and also how long they live. I just thought I'd mention COVID-19, since we're still in the middle of this pandemic. So it has to be said, in people with COVID, certainly in the earlier waves, who had bad lung disease, it was found in most of them, if they had a scan of the heart, that they would have some evidence of heart involvement. But serious involvement of the heart, actually, COVID is quite uncommon. The most common thing that happens is inflammation of the heart muscle, known as myocarditis. And in a few people, this has developed severely enough in that they have even died because of this. But in most people who develop it, fortunately, they recover, or they recover but have some degree of heart damage associated with this. The other thing is that we know with COVID, you are at more risk of developing blood clots. So blood thinners are given to a lot of people with more severe COVID infections. And certainly there was a note of, or it has been shown that there have been increased heart attacks in people with COVID because of blood clots also forming in the heart. It has to be said that the main problem, certainly in 2020, when COVID started, was actually people not coming to hospital because of worries about, getting infected in hospital. And actually there were fewer patients coming in with heart attacks, but we know that this was actually because more people were dying at home and were delaying diagnosis of their heart disease, which obviously was pretty bad. I think now things have, from that point of view at least, improved, and people are coming into hospital. So prevention obviously is a key issue with heart disease. We're talking really mostly here about the most common form of heart disease, was the coronary artery disease, where you have the buildup of plaque and cholesterol and so on in the body, and also prevention of heart attacks, which is part of the same process. So, of course, smoking cessation is vital in anyone who smokes. Fortunately, the number of people smoking in this country has reduced quite a lot in the last 50 to 60 years since it was discovered that smoking is, bad for people. But unfortunately, there are still quite a few people smoking, and that is still probably the most common cause of this in terms of preventable things. Regular moderate exercise has been shown to be very helpful. And moderate exercise is things like brisk walking or swimming. And unfortunately, among all the ethnic groups, South Asians have the lowest rates of exercise. So for many of us, this is going to be a key thing to do. And, even 30-minute brisk walk 5 times a week is enough to count as, regular moderate exercise. And actually, for most people, that's not very hard to do. And of course, if you start when you're younger, the more chance you'll have when you're older of being able to continue it. But, starting exercise at any age within reason is still good. Then there's also control of various things. So cholesterol, especially the LDL or bad cholesterol, blood pressure and blood sugar, because like I said earlier, diabetes is one of the most significant risk factors of coronary artery disease. And, a lot of this is by regular checking, medications, diet as well, and exercise, because actually blood pressure and cholesterol control have been shown to be improved by regular exercise as well. Now, in terms of diet control, it has to be said that doing more exercise is more difficult for most people than actually restricting the diet. And by restricting diet, actually reducing junk food is probably the number one here, and heavily sort of processed and sugary drinks. Just as an example, 2 sort of coffee shop lattes or a Danish pastry and a packet of crisps can have as much as 500 calories in them. If to lose the 500 calories worth, you'd have to do half an hour of running or 1 hour of leisurely swimming. Now, for most of us, that amount of exercise is actually quite difficult. But for people, especially who have junk food regularly, cutting down a small bit of that every day can actually make a big difference to their calorie intake, and therefore dietary control can be a lot easier. Now, there are a lot of controversies around diet, and even in the last 10 to 15 years, what we know about diet and different things has changed a lot. I think the biggest thing probably is that calories, not all calories are the same, and probably calories from sugar are the worst and worse than from fatty foods. And also when it comes to fats, although fats all have lots of calories, different fats have different impact on the body, and they're not all the same. I mean, a good example is nuts, for example, do have a lot of fat, but those fats have been shown to be very much protective for heart disease. So, the old things like soaking sort of 5 almonds and eating them the next day and so on, we know are actually very beneficial. Whereas fat, especially from things like red meat, are particularly bad for you. The other thing that's changed a lot is, which fats are good and bad in terms of things like margarine and oil. And actually, we know now that the processed fats in things like margarine are not good for you. So, certainly in my childhood, it was very much advertised, oh, this will reduce heart disease. Actually, a lot of those processed and hydrogenated fats are at least as bad, if not worse, than things like butter or ghee. So really restricting of fats like that is all important, and you can't think that, oh, I've stopped having ghee or butter, I'm going to have margarine, that's going to be any good for you. Definitely, I think we now know that that is wrong. Another important thing is portion size control. So it has been shown that over the last 50 years, the amount of food that people eat has been increasing. So as well as a more sedentary lifestyle, as a lot of us are sitting behind computers all day, of course, with working from home, that's probably even worse now than it was even a couple of years ago. But it's quite useful to, one, think of yourself as how much should you eat? Well, one standard size plate of food is probably enough for most people. And then also thinking how you want to distribute it. So ideally, if we divide it into 5, then about 1/5 will be protein, about 2/5 will be sort of whole grains and cereals, ideally things like wholemeal bread, brown rice, and so on. And then 2/5 will be fruit and vegetables. And ideally in that would be some of it uncooked vegetables and fruit. So certainly cooking does get rid of some of the nutrition of fruit and vegetables, particularly things like frying and cooking at high temperatures. Steaming tends to be a little bit better. So this is a good way of thinking when you're arranging your food and preparing meals of how to sort things out for your sort of best health. I think it's very important to note that it isn't ever too late to change diet, exercise, and other habits. You know, there is no issue with starting at an older age if you haven't been doing it so far, but hopefully have. So thank you very much again for this invitation, and I would be very happy to take questions about this and hear any comments you might have.
Thank you very much, Dr. Aggarwal. You covered the whole of the cardiovascular system diseases in 20 minutes. That's brilliant. And you packed in a hell of a lot of information. We have had a lot of people listening, and we have got some clarifications from your talk. So I'll take one at a time and leave you to finish off whatever information you want to add. The first question was, quite a few of us get pains in the chest. And we get pains in the chest quite often. We completely ignore them. Can you tell us what the different causes of the chest pain are, and what are the sort of salient features of cardiac pain that we should be very careful of?
Yeah, I mean, that's, I think, a very good question, and actually a very difficult question, because you know, there are so many things within the chest that can cause pain. So apart from the heart, you have the lungs, the stomach is not far as well. So a lot of people get, you know, distinguishing sometimes between indigestion and heart pain is difficult. Muscular pains as well. I think one thing is probably don't ignore it. But obviously, if you have a certain pain and you have it checked out and it isn't serious, then at least you know for that particular person that type of pain is you know, maybe muscular or whatever it is. I mean, the classic pain that we describe, you know, the tightness of the chest or pressure in the chest, especially when you're walking, you know, that's the most common pain that we say is from the heart. But I would say, for example, some people notice when they walk that pain is in the shoulder or the jaw. Sometimes people think it's toothache. Sometimes even people get that pain in the arms without any pain in the chest. So I think is sometimes that awareness that if you're getting some sort of discomfort when you walk or exert yourself, then that might be coming from the heart. You know, whether it's exactly in the center of the chest as we typically think about, or whether it's maybe slightly different to that. I think the other thing is, you know, how long is the pain lasting is another issue, and what is it related to? One of the very difficult things is people get pain, you know, what they think is gastric pain, say after eating. Now, of course, probably most of the time that is actually not from the heart, but I think, you know, certainly if people are getting pain in the stomach after eating when they go for a walk, that may well be a sign of heart disease, because, you know, at those times your body's using more of the blood to digest food, and therefore it has a bit less to supply the heart. So that might be a clue in some people that pain they're getting in the, what they saw, the stomach area, the lower chest, is actually heart pain. But unfortunately, sometimes it's very hard to distinguish exactly what the pain's coming from, and really the thing is not to ignore it, I suppose.
Is breathlessness also an associated symptom that we should take seriously? Or?
So that is also, yeah, I mean, breathlessness, even probably more than chest pain, has lots and lots of causes. But I think, especially in people with diabetes, we know that they often don't get the symptom of pain, they get more breathlessness. So again, you know, I think if someone, especially if you have diabetes and you're getting breathless on exerting and it's getting worse, you know, it might well be, well, that probably is a good time to get it checked out, because it could well be, you know, pain coming from the heart. And also there's a lot of other, you know, serious conditions that can be related to breathlessness. So it is worth having that checked out.
Are you able to elaborate a little bit more about breathlessness on exertion and how we should test ourselves out, maybe sometimes to see how far we can push ourselves and things like that?
Well, I think the main thing is, you see, you know, if you're finding that doing the same activity you're getting more breathless, then that's a concern. For instance, if before you were walking, you know, 1 mile, and then you got breathless, and now you're walking half a mile and getting breathless, then that is a sign that there is something going on. We've found, interestingly, for instance, in the pandemic, a lot of people have been doing, you know, there was a vogue early on for a lot of people doing more exercise, but over time, a lot of people have given up and doing even less exercise and working from home and sitting behind a desk for a long time. So people are just losing their fitness levels. So that's one thing. But if, you know, you are someone who is active and you're finding the same activities becoming more difficult, then that is really a sign that there might be something wrong, and that, you know, you really need to be checked up for that.
And what about going up hills and upstairs and things like that? Is that requires more exertion? So should we try that from time to time to see what we can do?
Well, I mean, ideally, we should all be doing exercise anyway. So I probably would say, well, everyone should be getting more active. Yes, of course, the symptoms are more likely to come out if you walk upstairs or walk up a hill, for example, because it's a bigger level of, you know, a greater level of exertion. But I wouldn't say that specifically you should do that just for checking out if you have a heart problem. Actually, probably you should be doing that anyway, and then maybe you won't need to have and develop heart problem in the first place.
Thank you very much. If we are in doubt about the chest pain, and if it lasts for longer than a few minutes, is it reasonable to say that we should take ourselves to A&E or get the ambulance or something to check it out, even if we think it might not be a heart attack?
Well, I think, yeah, I mean, typically we say if it lasts for 20 minutes or more, and especially if it's come on when you're not doing anything, then I think definitely you should be thinking about going to A&E, because, you know, the thing about a heart attack is that the longer you're starving a certain part of your heart of oxygen, the less chance that it will be able to recover. So, you know, the problem is if you think, well, it's probably okay, and then wait 4 or 6 hours, and then it turns out to be a heart attack, of course, you will have, you know, potentially suffered a lot more damage. Whereas if you, after like half an hour, said, oh, right, I'm worried about this, I'll go now, you could save yourself quite a bit of long-term problems. So I think certainly if people are having chest pain, really, especially at rest, they should be getting checked out soon.
Thank you very much. Now, the doctors often ask us about palpitations and things like that, and I'm not really sure whether we all know exactly what palpitations mean. Can you just give us a little description about, you know, what we would mean by palpitation, what you mean by palpitations, and what symptoms I should be getting?
So palpitation really means an awareness or an abnormal awareness of the heartbeat. For instance, if you do some exercise after that, you will feel your heart beating, and that's a normal thing. But on the other hand, if you're just sitting down, for instance, and then you feel your heart beating just as if you had gone for a run, then that would be palpitation, and that suggests that there is some abnormality with the heart rhythm. For some reason it's going very fast. Some people also get palpitations because they have the extra beats. So often people actually, they notice their heart beating, or sometimes they feel they've missed a beat. And although they feel they've missed a beat, actually what's happening in the heart most of the time, they're having an extra beat, but they're not feeling the extra one. So then they feel that they've missed it. And the other palpitations common thing is if your heart starts beating irregularly. So some people will feel that their heartbeat isn't regular, and if you feel your own pulse, you might be able to feel that. And that, sometimes it's something that's not concerning, but in some cases it can be this condition, atrial fibrillation, where you definitely should be on some medication. So I think if people are feeling those palpitations, then they should be doing something. And especially if people feel it in the daytime when they're sitting down, that's quite abnormal. It's much more common to notice your heartbeat at night, and that might not be actually a sign of anything particularly wrong.
How long should we be getting palpitations before we say we need to go to the GP or somebody and get checked out?
I mean, I think if people are getting palpitations and, for instance, they're feeling dizzy, that's something that needs to be checked out much more urgently. Or if they feel they really feel their heart pounding for more than about half an hour continuously, then that certainly should be checked out more soon. That's a sort of more emergency type situation. If people are feeling this on and off, yes, definitely they should go and see their GP. But if you just feel like occasionally you feel like your heart missed a beat, that isn't something that I would suggest needs investigation.
You mentioned in your talk that Southeast Asians are particularly more prone to cardiac disease and things like that.
Yes.
Do we know why we are prone to these things, and is there anything we can do to help ourselves?
Well, I think, there is a lot of research going on into this, because, of course, the huge South Asian populations outside South Asia as well, in the UK, US, etc. So I think a lot of it is really genetic makeup is quite different, and our ability to digest and absorb things like sugars and fats are quite different. So, for instance, South Asians tend to more commonly, when they put on weight, put on fat around the stomach rather than generally. And that we know is significantly associated with increased risk of heart disease. And I think, one of the other issues is that South Asian diet maybe is a big factor. There's a lot of South Asians eating a lot of sugar, and for whatever reason, we probably, if a same person was white and someone was South Asian and ate the same amount of sugar, the South Asian person's more likely to get diabetes. So, from what you're asking, really, what can we do to prevent it, is probably we have to be even more vigilant about our diet, especially about sugar intake. And, just there's other social factors as well, like the fact that on the whole, we do less exercise. So that's another thing that impacts on our worst sort of heart disease.
Can I ask you two tough related questions on this one? One of the things you did mention in your slide was that we don't do enough exercise and things like that.
Yes.
Is it possible for you to give us some tips on what we really, as a minimum, should be doing? Because the only exercise that most people that I speak to of the Asian origin is we walk a lot, but that's about all we do. So is there anything that we have to do as a must, really, to keep ourselves fitter and out of the reaches of the cardiac problems?
Well, I think that is important. Actually, walking is a good exercise, but the problem that I find with most people is when they go for a walk, they go for a leisurely stroll. So it's not really, exercise. It's just a gentle walk. I mean, really, if you were to have a walk that's going to help you from a cardiac point of view, it should be like a brisk walk, such that at the end of it, you feel like you have done some exercise. you should feel your heart beating faster. If you don't, then you probably haven't been having walking quickly enough. And, actually 30 minutes of a brisk walk 5 times a week is very much the guidance says that is enough. Moderate exercise is probably in some ways better for you in the long run than heavy exercise, because you're less likely to wear out joints and other things. But yeah, so that would be a very good example of something that most people can do. But I think the issue is not the walking, but it's the sort of walking quickly that most people aren't following.
So 30 minutes of brisk walk 5 times a week, preferably on an incline, so that we are sweating and pulse is going a bit fast, is what is recommended.
Yeah, I mean, an incline obviously means that you will have to do, it will exert yourself more, so you might not have to walk as quickly. But I mean, the main thing is you should really feel like after 30 minutes that you have done some exercise. If you come back to the house and feel completely fine, you haven't really done enough, I think.
Well, thank you very much for that. Also, I noticed that we've got an added problem in that a normal BMI is much less than the local people. And why is our BMI supposed to be lower than other people's?
I think it probably, well, I suspect it's probably because the bone structure and everything means that actually your weight, a person of a similar sort of overall shape probably weighs less if you're South Asian. And I think the other thing is because we're more prone to heart disease, even that slight increase in weight has more impact on your risk of getting heart disease. I mean, actually a BMI of 23 is not that low, I would say. I mean, it's not high, but I think it's achievable for majority of people if they make an effort.
See,
But
sorry,
I think the key is, of course, starting young, isn't it? Because, if you get as you get older, it's going to be harder and harder to try and sort of control your weight. And there are genetic factors, that are involved in weight. So, it's not just all about exactly what we eat and exercise. But I suppose for any individual, they have to maximize or they've got to minimize their chance of getting heart disease. And, for some people, that's probably a bigger sacrifice than for others.
Thank you very much. It is also very noticeable that Asians have a good beer belly most of the time, and they seem to put on the weight around the middle a lot more than other people. And I suppose that's probably because of lack of exercise and things like that.
I mean, it is partly lack of exercise, but partly it's just genetic, and that's the thing that we have to be very careful about, is that weight around the sort of, as you say, the beer belly, even though ironically most people aren't drinking the beer, but still developing a beer belly.
Thank you very much. Now, I wanted to ask you some questions that were related to cardiac problems that are what I'd call silent killers. And I thought hypertension was one of the ones that was causing problems because it quite often presents with no symptoms. Are you able to tell us a bit more about what we should be doing and how often we should be checking and what normal values, etc. are?
Yeah, so I mean, I think the probably 3 silent killers are high blood pressure, high cholesterol, and diabetes. So if we start with the high blood pressure, I mean, in essence, everyone, certainly by the age of 35, 40, should definitely go and have the blood pressure checked at one point by the GP. One-off readings are of doubtful value, especially if they're high. But if you go and have a blood pressure check and it's normal, it's very unlikely you do have high blood pressure. I mean, if you have a high value, probably you need to check it again. If you get persistent high values at that point, I mean, nowadays when people, because it's so easily available to get a home blood pressure monitor, that might be, if the blood pressure readings are coming out reasonable, that's enough. I mean, if there are real doubts, a GP would refer you for a 24-hour blood pressure monitor, where you get a monitor from the hospital or clinic. You wear it for 24 hours. It takes a blood pressure every hour, and that gives you a very good idea of what your actual blood pressure is. And in terms of values, So at the moment, high blood pressure is generally defined as greater than 140 for the higher value, the systolic value, and more than 90 for the diastolic value. Although for the elderly recently, which is defined as above 80, the upper values given as 150 and above should be defined as high blood pressure or hypertension. And ideally, when you treat people for it, you're looking to get the blood pressure down to 20 over 80 or even slightly less than that. I think, yeah, that's really the key. And, in terms of controlling blood pressure, actually losing weight, doing regular exercise, these also help the blood pressure. So it's just important to know that. I think high cholesterol, again, currently the recommendation is at age 40, everyone should have a check of their cholesterol. Really, ideally, they should have a sort of MOT from the GP. Although I know of recent, because of all the difficulties getting appointments, that system's somewhat gone out of the window. But, ideally, people would have that, and a blood sugar. And if the value is normal, you don't need to necessarily get it done every year, but maybe every 3 or 4 years. Of course, if it's abnormal, then you will need to get it checked more often and you might need medication. And same with diabetes, really. If the blood sugar is fine, then great, probably for a few years you wouldn't need repeat checks, but certainly if it's abnormal, you would need more investigations, because these are silent killers. If you don't detect them, they can keep going. They very rarely cause symptoms. And usually by the time they cause symptoms, they've caused quite a lot of damage to the body, which is most likely reversible. So I think, it is important to get checkups for all these things on a regular basis. And the older you get, the more frequently you would need a checkup, really, because they tend to all come more commonly with age.
So by the age of about 35, 40, it is worth getting your blood pressure and routine bloods and things like that checked to just make sure that you haven't got any factors that are likely to cause you problems in future.
Exactly.
There was one question that had come through for angina. What is unstable angina and stable angina?
So stable angina is the typical symptom where when you exert yourself, chest pain or pressure in the chest, and then when you stop exerting yourself within about 5 minutes, that goes away. Unstable angina means that you're getting that symptom, but without exertion. So rest, you might get the similar symptom, and that suggests, a much more increased likelihood of a heart attack. So that is something that needs to be seen to straight away. Actually, nowadays we're finding that because blood tests for damage to the heart are becoming so sensitive, most of the people that used to be diagnosed with unstable angina, really now they're having a small heart attack. So really, if you're getting those symptoms at rest, you do need to go to hospital straight away.
Somebody wants to know what is intermittent claudication and what they should do about it.
So intermittent claudication is actually to do with the legs, and similar to the way in the heart you can have deposits and narrowings, the same process can happen in the blood vessels that supply the legs. For most people, one side will be worse than the other, and essentially when they go for a walk, they will find that they're getting cramp in the back of the one leg, and when they stop walking for a few minutes, again the blood supply improves and the pains go away. It has to be said that is almost always, probably 90% of the time, that happens in people who are smokers. So it's a much, like say the heart, a lot of people who don't smoke have diabetes, high blood pressure, other things get it. But for the claudication, it's quite unusual in non-smokers. I mean, it does happen sometimes, but it's a lot less common. And essentially, again, they might need treatment, medications, blood thinners, and sometimes they need surgery as well to correct that.
Can you tell us something about transient ischemic attacks and strokes, and what sort of early signs we should be looking for?
Yeah, so I mean, this is basically the same process of deposit of cholesterol and other material in the blood vessels, but this time supplying the brain. So transient ischemic attack, by definition, is where the symptoms last for less than 24 hours, but in most people they're much shorter than that, a few minutes. And a stroke is if the symptoms last longer. And I mean, there is something called the FAST that you might have seen in GP surgery and so on, which basically has the most common symptoms. So like F is for facial drooping, so the face on one side droops, or A is for arm weakness, but that could be arm or leg, so usually one side of the body becomes weak. And then S is for difficulties with speech. So you might find that someone can't speak properly, or often actually that is associated with part of their face becoming droopy. And the T is actually a reminder for time. That means you need to go and seek help urgently, basically 999, and get to hospital. So, some people, the symptoms go within minutes, in which case we would say that was a TIA or transient ischemic attack. But if it doesn't go in minutes, then, you need to go to hospital, and it might well be a stroke. And again, that's really caused by a blood clotting part of the brain. So the treatment is, again, blood thinners, and, we have stronger things to really break down those clots as well if you go to hospital in a timely manner.
Thank you very much. I think that you answered the next question, because somebody wanted to know what FAST written on the ambulance meant. So you explained that for us already. Thank you very much. But I think the important thing is that even if you have got a stroke that you recovered from completely, or a transient stroke of some sort that you recovered from completely, you still need to go and see somebody for advice, because you can find further ones coming, and you can prevent a stroke from it. So I think that's quite
exactly. So a TIA, we would say, is a very high risk of having then a bigger stroke. So actually, you could almost say it's lucky you only had a TIA or transient ischemic attack, so you can get investigations and treatment quickly for that.
You mentioned heart failure and leg swelling, etc. Can you tell us what the early symptoms and signs of heart failure and what we should be on the lookout for?
So the most common symptoms and signs, well, really are breathing difficulties. So again, breathlessness, typically on exertion, and swelling of the feet. If you're, if you have those, then it's quite possible you've got heart failure. And there can also be a sign of kidney failure or even liver failure. I think people who are known to have heart disease and get these symptoms, then it really is very likely heart failure. So that needs treatment. I mean, it's not an emergency like some of the other conditions, but it's one where definitely you would want to have a heart scan to see what the heart function is like. And these days, usually GPs will get a blood test, NP, which is quite a good way of, if someone's got breathlessness and they're not sure why, if that's positive, it often suggests that they have heart failure.
There's a question on venous grafts and artery grafts. Are you able to just throw a bit of light on some information regarding their longevity and things like that?
Yeah, so when you have a bypass, which means you're literally bypassing blockages in the heart or narrowings, almost always now one of the arteries comes from inside the chest, so the surgeon puts that, but also most of the time they will need to take either veins from the leg or some arteries from the arm. And there is no doubt that there is more and more evidence that using the arteries to do the operation, they last longer than the veins. Because often the veins are very big in size, much bigger than the actual arteries in the heart. So if you use an artery to bypass it, it's designed naturally to tolerate higher blood pressures, which it's going to face. I think most of the time the surgeon who does the operation is aware of it, and quite a lot of them are using the arteries as grafts. controversial whether it makes a difference, whether it's even more important in South Asians or not than others, because of this possibility that we have smaller arteries than Caucasians. But I think that's somewhat open for debate. But definitely it has been shown for most people that is has a better outcome.
Thank you very much, Dr. Aggarwal. You've got about 2 or 3 minutes left to just mention your key messages if you wish to.
Yeah, I think really the key message is, I think the first one is, not to ignore the symptoms, especially of chest pain, because, the sad fact is a lot of people who ignore the symptoms and are having a heart attack, by the time they do go to hospital, if they reach hospital, that is to say, they've probably had a lot more damage in the heart than they thought. So it's certainly better to be safe than sorry. And it's a tale of woe in our hospital on a weekly basis that, people have come in and ignored things. And then by the time they've come, it's too late to really give them the best possible treatment. And I think the other key message is that, prevention is very important, and going for a checkup for, blood pressure, cholesterol and blood sugar, is really important, and not missing those appointments for those chances for these things to be detected, so that, if you're starting to develop a problem, whether it's diabetes or something else, you can get early treatment and prevent a huge number of complications that can happen if you ignore it and only go once you really develop really diabetes or blood pressure or anything else. So I think those are the keys really. And of course, please take care of diet and exercise. Yeah.
Diet and exercise are the 2 things that you highlighted quite well, and you gave very specific instructions about 5 times a week for about 20 minutes. And really, your pulse should go up, and you should maybe sweat a little bit. And using a little bit of forced exercise is not a bad idea at all. So that was, for me, a very good key message. And also these early strokes and indicators of impending stroke, I think, is not worth ignoring. So that's another thing that's worth probably paying more attention to.
Absolutely.
Well, thank you very much, Dr. Aggarwal. That was a very, very useful session, and I'm sure everybody found it very helpful. I think we covered most of the questions, although obviously we cannot answer all the questions in an hour which we have been given. But thank you once again for being a very nice lecture. Okay, may I also thank our IT team for organizing this for us, and Mrs. Gayatri for organizing the sessions. And most of all, may I thank Swami for allowing this to happen and make this happen for us, because without his grace, we couldn't really do anything. Thank you very much indeed, Dr. Aggarwal, for a very nice session.
Thank you very much.